Mark Saylor is head chef for a retirement community in Dunedin, Florida.
I'm a chef, so I'm on my feet constantly. It's 10-hour days, so anyone that's in this business working on the line is on their feet for 9-10 hours straight. There's really no sitting time, so it's a lot of strain on your feet, which tie into that back pain, I think.
His career is physically demanding, requiring him to bend frequently, lift heavy objects throughout the day, and stand for long hours. After working this way for years and coupled with accidents that affected both his Achilles tendons, Mark's body was telling him enough was enough.
My pain probably started about 15 years ago, I think. I had an accident with my left Achilles. It seemed that having to be non-weight bearing on that, it seemed to cause problems in my lower back. And then I let that go for several years, and eventually I ruptured my other Achilles, and I think that tied into more back pain that I was having. My pain felt like a sharp stabbing pain, sent like an electric pulse down my leg, and my toes would often go numb. Almost felt like a knife in the lower back.
Eventually, the pain prevented Mark from spending precious quality time with his wife and children.
Pain affected me in the ways of I couldn't take the walks with my wife, couldn't do things with my kids. It was hard to even go shopping. I mean, I was always that guy hunched over on the shopping cart walking around the store. Couldn't even hold my daughter in line. I remember being at Disney and couldn't even pick her up and hold her for more than 3-4 minutes without the pain.
Working became almost impossible for Mark. In an attempt to resolve his pain, he tried conservative treatments, including chiropractic care, massage therapy, and pain medications. This approach only masked his pain and never provided him with lasting relief.
Work was agonizing. It was tough. I got to the point where I almost wanted to try and file for a disability, but it was you work on the line and you're standing, so every time there wasn't a ticket, you'd kind of kneel down to the ground and try and relieve some of that stress. So it was painful. I mean, there was times when it was just agonizing to even get out of bed, or it hurt too much to walk, to get in the car and drive, and then when you went to get out, the pain was there in your lower back. I finally got to the point where my pain was just agonizing, and I was at the very end, and it was either file for disability and stay at home and just live with the pain, or go through with something that I've seen commercials and I've heard about other people doing it, and it was just kind of a life-changing choice for me.
After hearing about stories of other people's successful Bonati Spine procedures on television and radio, he contacted the Bonati Spine Institute for an appointment.
The doctor care was great. They took me right in. There was no wait. They took the x-rays. They took the MRI. The consult was immediate, and it was with Dr. Bonati himself, and we discussed he knew right from just where my pain was. He looked at the MRI, and then he kind of looked at me and said, "This is where your pain is," and it was exactly what I has experienced. So I thought that was neat. He knew right where the surgery needed to be.
The exclusive Bonati Spine procedures are performed using conscious IV sedation.
And what that involves is, this is all intravenous, and we use a combination of several different medications, so that way it presents for a much smoother experience for the patient. So the entire benefit of doing the procedure this way is that way the patient is alert and talking and able to pinpoint exactly where the problem is to the surgeon while they're on the table. Shorter recovery time, less pain when they're done. Obviously, the whole idea is to get them pain-free. And we're able to know right away while they're on the table. Secondly, they're not going to get general anesthesia, so they won't have any kind of prolonged post-op recovery.
He had one targeted Bonati Spine procedure in October 2015. Mark knew while he was in the recovery room shortly after surgery, his pain was eliminated.
It was L5 in the spine, so it was I had a laminectomy and a discectomy, so I was able to alleviate all that nerve pain. Pain was gone in the recovery room, and told me to get up and walk down the hall, and I could feel the pain was gone. Within 3 days, I was ready to go back to work. It was, within a week, I was back to my normal self. I was just watching the weight restriction. I felt like I could already lift 50 pounds, even though, they keep you at a very minimal. But the recovery was fast, and within 3 months, I was back to full playing sports and everything I loved.
Now pain-free, Mark is back to spending time with his family, playing his favorite sports, and enjoying his time in the kitchen again.
It's been great. I've been able to do all the things with my wife and family since. I've been able to do the sports that I love, things that I was ready to give up on. Everything from tennis to kayak, softball, basketball, everything. I mean, it's just brought me back to doing everything that I wasn't able to do in the past. And work is fantastic. Like I said, it's a long, days are long, so you can do 10 to 12 hour days, but I don't feel that pain anymore to where I would even just want to go home from the pain. So currently I just love my job. I love working. I love, the whole atmosphere now.
With more than 75,000 successful procedures performed with 98.75% patient-reported satisfaction, the experience at the Bonati Spine Institute is unlike anything you'll receive at any other facility. Patient advocates provide personal attention to patient care in every step of the process, and you can contact your surgeon with any questions you may have before, during, and after your procedure.
I went through 10 years of fear to get the pain alleviated. I felt no pain. My life's completely changed. I feel like I had wasted 10 years not doing it, and to do something where I guess the biggest fear is it's back surgery. They're near your spine. You get that worry that you're gonna wake up and not feel your legs, but that's not there. And I'd recommend that to everybody. It's a great surgery. I've been to a couple other institutes around town, and just in the fear of getting the process done, the whole insurance process was faster. The way they treated you when you walked in the door right away was better. He's just, he's got it right, so it's very comfortable when you're in there by everyone that you meet. I would highly recommend Bonati to anybody, yeah.